Hi, this is Dr. Christopher Van Tilburg with the Hood River County Health Department. I would like to give you a brief update on this Wednesday morning. Many of you have seen the news from the past few days from Union County, Oregon. They had a single day where 99 cases were reported. That was last weekend. And they have now well over 200 cases attributable to a single outbreak. It's reported by the Oregon Health Authority as a faith-based gathering or multiple gatherings. And so it's a word of caution. We're trying to get Hood River to move from phase 1 into phase 2 safely. We're also really concerned about transmission among the Hood River County residents who are gathering in groups and transmitting coronavirus. I looked at the data. I don't think that the primary source for our increase in cases over the last week is tourists. I don't think the primary source is seasonal farm workers. I don't think the primary source is from workplace transmission. Many of the companies that I've visited and talked to are doing a fabulous job at protecting their employees and protecting their clients and customers. Many of you have seen the parklets, which have sprung up around the city of Hood River, which is a way of getting people some safe ways of going out to dinner on the sidewalk. So that's a really positive development. I want to talk about masks. And I want to address this nationwide and Oregon-wide issue of should masks be required or not. Masks are required in some establishments in the Portland metro area. Some grocery stores are requiring masks. Some other stores are requiring masks. But before I talk about masks, I want to remind everybody of what Trish Elliott, our director at the health department, has dubbed the 4 pillars. It's important, critically important, to do all 4 together. So maintain physical distancing, wash your hands often for 20 seconds at a time, and stay home if you're ill and call your doctor. And that third one, stay home if you're ill, we still have people who have mild illness and are out in the community, so please stay home. Fourth, wear a face covering. Now, there's a lot of information about face coverings. There's a lot of questions of if they work or not. Let me tell you how they work. They work in 3 ways. First of all, wearing a mask prevents somebody with coronavirus from transmitting it to somebody else if they talk loud or they sneeze or cough. So these might be people who don't have symptoms yet or people who never will get symptoms. So pre-symptomatic carriers or asymptomatic carriers. Or they might be people with active coronavirus and have symptoms and they just don't realize they have coronavirus yet. So they prevent people from spraying droplets. And the added benefit is masks prevent other infectious diseases that are respiratory and aerosolized from being transmitted. So that's an added bonus. It's not just coronavirus. The second way masks help is they help give us all a reminder that coronavirus is still out there and we need to be careful. The third way they help, and I'm going to give you an example, but the third way they help is that they do prevent people who are free from coronavirus from inhaling particles. Now, do they work as well as a powered air purifying respirator that healthcare professionals use? No. Do they work as well as a self-contained breathing apparatus like the fire department wears? No. Do they work as well as a medical grade N95 mask? No. But they do help. We don't know how well they help because the studies are just not quite available yet, and so we don't know how much they help. But let me give you an example of how a mask can help you and keep you from getting coronavirus. And hopefully, if you're not a mask wearer, this might convince you. But let's say you're at home, you're making chocolate chip cookies, you run out of vanilla. You just got to run to the grocery store, zip in, zip out to get some more vanilla. That's all you got to do. You decide not to wear a mask. You're only there for 5 minutes. You go into the grocery store, you go down the aisle for the vanilla, you grab your vanilla, you hear somebody behind you, and you turn to that person, and they're 1 foot away, and they sneeze right in your face. That alone could give you coronavirus, and that alone could protect some or all of the droplets from getting on your face. And so, wear a mask. Please wear a mask. We want to get the county to reopen. We want to protect people from getting coronavirus. We don't anticipate this to be a lifelong issue, but at least for the next several months as we enter this next stage in the pandemic, wear a mask. I want to remind you all, if you don't know, the health department is working really hard at a number of sectors: long-term care facilities, homeless population, and the farm workers. So to date, roughly, we've given the farm worker community, the packing houses and the orchards and the other farms, 54,000 cloth masks, 360 bottles of hand sanitizer, some of those gallon bottles, 6,000 disposable masks, and almost 400 face shields. So we are addressing this in the community, and we need your help. Thank you. Be positive and be safe.